Good afternoon, ladies and gentlemen. It's my pleasure to participate in this symposium and to present psychosocial care of teenage pregnancy cases in Myanmar GP practices. First, I would like to present brief about the reproductive health profile and teenage pregnancy in Myanmar. And early childbearing in Myanmar is unusual, and average marital age of Myanmar is 21 years, and mean age at first birth for Myanmar women is 22.8 years, and only 10% of women aged between 15 to 49 have given birth before they reach 18 years. Yes, please take a look the teenage pregnancy incidence in Myanmar. The incidence of teenage pregnancy, you look, there's a downward trend from 2001 to 2011. From in 2001, 17.4 to 16.9 in 2007, and in 2011 it's 10%. And you see that incidence of teenage pregnancy seems to be decreasing trends. However, it may be due to underreporting or maybe data, and the data is from the hospital survey. And teenage pregnancy is still one of the priority reproductive health issues in our country. Here's the complications of teenage pregnancy, and it is an acute complication. Regarding the maternal complications, first is abortion. In our country, abortion is highest in the youngest age group of 15 to 19. And next is anemia and poor weight gain. And another complication is being infected with sexually transmitted diseases, septicemia and hemorrhage, like antepartum hemorrhage, postpartum hemorrhage, and puerperal psychosis, and finally maternal mortality. And this is the neonatal complication, is also the acute and premature baby, and also low birth weight. Low birth weight gives rise to infant deaths and birth-related defects such as mental retardation, mental illness, cerebral palsy, and which is a burden not only for the family but also to the society, and also respiratory distress syndrome. The next complication is stillbirth and also congenital abnormality, and all are linked to the neonatal mortality. Here is the long-term physical complications of teenage pregnancy. Poor nutritional status both for mother and children, and next is the delayed development of languages and behavioral problems, and which give rise to social and psychological problems. And here is the long-term social economic complications, and it gives us more of future adolescent births, and also the adverse socio-economic conditions, premature termination of education, dropout of the schools, and poor earning capacities due to less of job. And thus, comprehensive care for teenage pregnancy is demanded, and the role of GPs becomes critical to include psychosocial care beyond clinical care and routine antenatal care. This is the model of teenage pregnancy in Africa. And if we study that as in our Myanmar context, first is the social, when we look at the socio-economic condition, as you know, teenage pregnancy is related with is more common in the poor socio-economic status, and this status also causes lack of knowledge and information on how pregnancy occurs, how to prevent them, and where to obtain protection, resulting in teenage pregnancies. And they lack information about health consequences of teenage pregnancy and also about seeking its services. And next is the urbanization. That's the urbanization. And in Myanmar, changing social environment And so due to the negative influences of media, karaoke, and rapid rural-urban migration of the young people for searching employment, all have contributed to high teen pregnancy rate. Migration and urban migration is also one of the factors contributing to teenage pregnancy in Myanmar. And education attainment is it is also in Myanmar we found that it is also related with the teenage pregnancy. Here's the family and cultural structure. Regarding family and cultural structure, in Myanmar, pregnancy without marriage is not acceptable and disgrace even to the family. In a traditional Myanmar family setup, living together in premarital sex is not encouraged, but parents are unwilling to talk to their teens about sexuality. And complications following illegally induced abortion have still been recognized as an important cause of mortality and morbidity in Myanmar. Maternal deaths due to complications of teenage pregnancy or teenage following with induced abortion can also reflect the maternal mortality ratio. And lack of information and a lack of knowledge and information about ARH services. The services here you see in Myanmar, the services provided by from the public sector or even from the private sector are not well utilized. Even the service is access to them. Young Myanmar people have still limited access to sex education and also to the ARH services. Yes, here is the complications. And this is the assessment on knowledge, perception, and services of GPs to psychosocial care of teenage pregnancy among 122 Myanmar GPs, and it is studied in 2014. First, regarding the knowledge of GPs to psychosocial care of the teenage pregnancy, out of 1 to 2 Myanmar GPs, 53% were female. In my study, 53% were female. And 63% of them knew about the psychosocial illness suffered by teenage pregnancy, such as anxiety, depression, social judgment, and isolation. And 69% noticed the social consequence of teenage pregnancy. That is a school dropout, conflict with family, and conflict with in-law family and husband, early divorce, financial problems, drug addicts, looked down by community, child rearing problems, jobless, and domestic conflicts. And here is the practices of GPs to psychosocial care of teenage pregnancy. It was found that 66.4% referred to OG specialists, and 47.5% of GPs provide antenatal care to teenage pregnancy. And here's the 12.3% did a mental health assessment and counsel psychological trauma. And 19.7 provided social education. And 35.2% provided counseling on contraception. And 14.8% advised the patients and family to social problem. And 13.1% communicated with other social organizations. Regarding the perception of GPs on teenage pregnancies, and 15.6 strongly agreed that teenage pregnancy is a social issue. 68% agreed, and 13.9% is on no comment, and strongly disagrees is about 0.8%. So, majority, they agree that teenage pregnancy is a social issue. And for the next question for the teenage pregnancy, is it teenage pregnancy a health issue? 15.6% of respondents. Respondents strongly agreed, and 68% agreed, and 30.9% no comment, and 0.8% is strongly disagreed. So, majority as respondents a teenage pregnancy is they regarded teenage pregnancy as a health issue. And based on the findings, current Myanmar GP services to teenage pregnancy is there's a high knowledge. There's a high knowledge and positive perception on teenage pregnancy, and lower and limited services to antenatal care and psychosocial care of their teenage pregnancy patients. So when we observe about the role of the GPs in teenage pregnancy, as usual, it's a person-centered care, and the GP provides a personalized care, which is cost-effective care, and not only the physical care, but also the physical, social, psychological issues, and it will be confidential. And for regarding the preventive care, consequences of teenage pregnancy, and empowering pregnant to solve the social cycle problems, and they also provided contraceptions for further prevention. And regarding the primary care, so GP has to prove about the early recognitions of the complications, which is give rise to the maternal mortality. So it is important the early recognition of the complications and timely referral to the to the OT specialist or to the hospital. And for the comprehensive care deals not only with the physical, but also social and psychological problems for individual, family, community, since those factors affected on health of the teenage pregnant woman. And also there may be a coordinated care with the OG specialists and NGOs, non-government organizations, and also with the social welfare and community workers and education staff. And regarding the continuity of care, GP provide continuity of care from antenatal care until long-term illness. In conclusion, and based on my studies and based on my survey, and once found that in conclusion, GP's practices is the entry point of safe delivery, postnatal and lifelong care to reduce psychosocial effect of teenage pregnancy in order to prevent consequences of health and social implications. So, thus, Myanmar GPs should be provided training to provide quality antenatal care, including social, psychosocial care, not only the physical care, but also we have to provide psychosocial care to have a quality GP practice. And that's all my presentation, and thank you for your kind attention.